Very good afternoon to all of you. I'm Sayukta from Prostate Wellbeing Team, and I'm sure all of you must be doing really good. Today, we are going to discuss a very important topic: benign prostatic hyperplasia (BPH). Now, BPH is the non-cancerous enlargement of prostate. Usually begins in 50s in men, and in many men, it may cause obstruction to urine flow. So today, we have with us Dr. Surya Prakash to throw more light on the subject and guide us on what's right for diagnosis and treatment of BPH. Dr. Surya Prakash holds an MS from PGI, a prestigious FRCS from Edinburgh, MCH from NIMS, and a DNP. Doctor is also a professor of urology at Kamineni Hospital, and he also has his own clinic, Surya Kidney Hospital at Chaitanyapuri, Dilsukh Nagar. So, Dr. Surya Prakash, a very warm welcome to you.
Hello. Oh, thank you, madam. Hello, viewers. I'm Dr. Surya Prakash, urologist. I'm here to share my views and tell you everything about BPH, what a patient with BPH needs to know.
Right, Doctor. So, as today we are going to talk about BPH, which in layman's term we many a time say enlargement of prostate, benign enlargement of prostate. First of all, Doctor, what is prostate? What is the use? Where it is positioned, etc.
Yeah. Uh, Prostate is a gland of walnut size shaped gland. It is present only in men, and it is present just below the urinary bladder. So the normal size of the prostate is about 18 to 20 grams. Uh, it causes symptoms when it gland enlarges in size. Usually, the enlargement occurs in men above the age of 50 years. As I told you, the urine passage goes through the prostate. The urine from the bladder has to go through the prostate and comes out through the penis in men. So what happens is when the gland enlarges, the urine passage which is present in the prostate gets compressed by the enlarged prostate. We call the prostate in normal or in medical terms as it has got two lobes, right and left lobes. So when these two lobes enlarge, they compress the urinary passage and thus cause difficulty in urination. So the enlargement is usually benign. Sometimes the enlargement can also be due to cancerous enlargement, which is little rare compared to benign enlargement. Today we'll discuss about the benign enlargement of the prostate, which causes obstruction to the urinary stream and causes symptoms.
Absolutely. So today we are going to talk about BPH, benign prostatic hyperplasia, benign enlargement of prostate. We'll also talk a bit about cancerous prostate or prostate cancer later. But before that, doctor, you said there are symptoms and the symptoms are related to obstruction of urination. So what are these symptoms like so that our viewers know that in case they have these symptoms, they need to go and check with a urologist?
Correct. So the symptoms are called basically they are divided into two types. They are called the storage symptoms and the voiding symptoms.
Okay.
So when
Yeah.
the prostate enlarges and it causes obstruction to the urinary flow, majority of the men will have slow urination. That means the urine of the flow of the speed of the urine flow will be slow. They need to strain to pass urine. They need to exert to pass urine. That's called straining to pass urine. Slow urinary stream, intermittency. The flow doesn't come like a like continuous flow. It just stops and comes like that. It's called intermittent urination and sense of incomplete evacuation. Because there's an obstruction, the bladder doesn't empty completely. So the patient feels that even after completion of the urination, he feels that there is still some urine remaining in the bladder. That is called sense of incomplete evacuation. And the other important bothersome symptom is a nocturia. Normally, a person doesn't wake up more than once in the night during sleep to pass urine. But patients with this benign enlargement of the prostate, they wake up quite often, more than 2 or 3 times to pass urine, which causes disturbance in their sleep time. Apart from that, they may also have symptoms like frequent urination. Every hour, every 2 hours, they go to washroom to pee. And other thing, important bothersome symptom is urgency. Normally, a person can hold urine for about still the bladder gets distended for 3 to 400 ml because the normal bladder capacity in an adult is 500 ml. When the prostate enlarges, it irritates the bladder. So the patient passes urine every hour. Once the bladder gets the capacity of 100 to 150 ml, they feel like they desire to pass urine. That's called frequency, urgency, and sometimes in the late stages they even can have urgent incontinence. So predominantly they have obstruction to the flow, symptoms like poor flow, straining, intermittency, sense of incomplete evacuation. Along with that, there may be storage symptoms like frequency and urgency.
Okay. Now, doctor, as you explained the symptoms, which is mostly related with frequency, urgency, and many a times it may also have incontinence,
Slow space.
nocturia, right, getting up during night to pee is
Yeah.
also there as an important symptom. But the thing is that these symptoms are so common after a certain age. When we talk to our elders that if you have these symptoms, let's go and talk to a urologist, they'll often say that, no, 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 now I'm aging. So, this is bound to happen. I'll have to live with it. Or, I'm a diabetic or, other patients. So, are there other medical conditions where similar, symptoms can be seen?
Yeah, yeah. I think it is a very apt question. When I ask these type of symptoms to a patient who comes to my clinic in 70s or 80s, they say, doctor, this is age related. I've been living with these symptoms for many years. They think it is normal for the age, but it is not normal. And when you examine, the patient may be having a full bladder, he'll be passing urine with very slow stream. So this is because of lack of awareness. So a 60 or 70-year-old person also should be able to pass urine freely without any obstruction. So it's a misconception or a myth that as age increases, they have to live with these urinary symptoms. So if the patient of above a 50 has these symptoms, they have to consult a urologist and get them evaluated for BPH or whatever. So another question what you asked is, are there any other conditions which can cause
Hmm.
similar type of symptoms?
Yes.
As you said, the diabetes, long-standing diabetes which is present for more than 10 or 15 years, can affect the bladder. Of course, you all know that diabetes affects all organs, and a condition called diabetic cystopathy occurs in patients with long-standing diabetes. In this condition, the bladder becomes weak. It cannot expel the urine. It cannot contract enough to expel the urine uh, from the bladder. So they retain a lot of amount of urine, and they can have symptoms like frequency, slow stream. So we do need to do certain tests to differentiate it from the prostate enlargement. The symptoms are similar to prostate enlargement. Other condition called stricture of the urethra. So the below the prostate, the urine goes through another tube called urethra, which is present in the penis. So if there is any obstruction in this urine passage, any scar or fibrosis, it is called stricture urethra. The symptoms are almost similar to the symptoms caused by prostate enlargement. And other conditions like overactive bladder, a stone in the bladder, and rarely malignancy in the bladder also can cause these type of irritative symptoms. And that's the reason why the patients with these symptoms, what I mentioned, should
Right.
consult a urologist, and not assuming that these are because of the prostate, and prostate enlarges with age and I have to live with these symptoms. That's wrong. So there can be other conditions and sometimes some serious conditions which can cause these symptoms, and you should consult a urologist.
Right. So the bottom line is, in case you have these symptoms, just don't associate it with your age. You're not bound to live with it. Go and
Yes.
consult a doctor, consult a good urologist. They'll diagnose, they'll find out what it is, why it's happening, and they'll treat it. So trust your doctor. That's really important. Now, doctor, because you said many a times it can lead to other serious medical conditions, the symptoms, as they are similar in many
Yeah.
other cases. Though we are talking about benign enlargement of prostate, my next question is, do prostate cancer has similar symptoms?
Yeah, prostate cancer in late stages can cause these type of symptoms. Actually, the prostate gland itself has got two components: glandular component and stromal component. The obstruction caused by benign enlargement arises from the center of the prostate, whereas most of the cancers, they arise from the periphery of the prostate. So the cancer and the benign enlargement, there are two different areas in the prostate where these conditions occur. But still, another thing is, a patient with malignancy can also have a benign enlargement of the prostate, and the symptoms may be because of BPH, and he may be having a coexistent cancer.
Hmm. So my question, I asked this question is because just to rule out that you don't have
Correct.
prostate cancer, it's equally important what we were talking before, that we need
Yes.
to go and consult with a doctor. So it's
Yes.
always a good idea. It's the only good idea. Now, doctor, because we are talking about the symptoms, many a times what happens, there is no symptom, for example, but a person had gone for a, say, annual medical checkup or gone for a ultrasound and came to know that the prostate size is bigger. Then they go and consult a doctor. So I'm sure you also get patients where there is no symptom, it's asymptomatic, but still their prostate is, has enlarged. Uh,
Enlarged.
would you like to throw light on that?
Yeah, because nowadays everybody goes for a regular checkup and goes and gets an ultrasound, and ultrasound shows enlarged prostate. So
Hmm.
if the patient doesn't have any symptoms, we usually don't treat them. They
Okay.
don't require any active or medical treatment.
Hmm.
This is one condition where the treatment is driven by the symptoms, not just by the enlargement of the prostate. We do see patients who have got a very large prostate but without any symptoms, and they do not require any treatment. And at the same time, we see patients with small prostate with severe symptoms. They definitely require treatment, even sometimes surgery. So the treatment is basically depends on the symptoms, and we give a score to these symptoms. The American Association has given a scoring system called IPSS, International Prostatic Symptom Score. Based on that, the symptoms are divided into mild, moderate, severe, and patients with mild symptoms can be managed with their some lifestyle changes. Moderate symptoms, they require medical treatment, and patients who have got severe symptoms, in some cases, they require surgery. So just mere enlargement of the prostate doesn't require symptoms. But if you consult a urologist, we do certain tests like sometimes a digital rectal examination and even a test called PSA to rule out prostate cancer if the enlargement is because of condition like cancer.
Right.
Yeah.
Now, doctor, coming to diagnosis, when a patient comes to you with these symptoms, what are the tests that you normally recommend? You have already mentioned a few, but again, in case of BPH, what are the tests that you normally recommend?
Yeah. So when a patient presents to our OPD with these symptoms, we quantify the symptoms. How severe are the symptoms? For a patient who is educated, we give them a questionnaire, and based on that, we know how much is the what is the severity of the symptoms, and how much is the patient bothered because of these symptoms. Then we examine the patient, we examine the abdomen, we examine the genitalia, and the prostate can be examined by doing a digital rectal examination. We put a finger through the rectum and feel the prostate. And by doing a rectal examination, we can grade the prostate, whether it is grade 1, grade 2, or grade 3 means a large prostate. And then once we do a clinical examination and examine the prostate, we ask certain investigations, certain routine tests like complete urine examination, and we also
Hmm.
ask ultrasound of the abdomen and the pelvis. The ultrasound will tell us about the what is the how are the kidneys, how is the urinary bladder, whether the bladder is emptying completely or not, is the bladder thickened because of the long-standing obstruction, and the ultrasound can also tell us about the size of the prostate. And after that, we do a test called uroflowmetry. In this test, we ask the patient to pass urine in a flow meter. So this flowmetry test tells about the flow velocity of the urine flow. So based on that, there are certain cutoffs. What is a normal urine flow for a male? What is obstructed flow? How severe is the obstructed flow? We quantify the flow velocity and then grade I can tell the severity of the condition. So basically, a clinical examination with a proper history and investigations like complete urine examination, ultrasound of the abdomen and the pelvis, and uroflowmetry. And in some cases, we ask for a serum PSA to rule out prostate cancer. The
Okay.
most cases complete the examination and investigations.
Fair enough. Fair enough.
Yeah.
Now we have with us Tanishq Rajoria, a viewer, and the question that he's asking is, what happens if it is not treated? If BPH is not treated?
Yeah, right. So what happens? Their life quality of life gets affected. If the person who has got these symptoms, if he continues to live with these symptoms, you know very well they can't move about, they can't go out with the symptoms like frequency, urgency, and if neglected, suppose they continue to live like this, if the bladder is not emptying completely, the urine is stays in the bladder, the residual urine can predispose to infections. They can have recurrent UTI, and the UTI the bladder infection can spread to the kidneys. They can have pyelonephritis. Sometimes the enlarged prostate, the vessels in the enlarged prostate can rupture and can cause bleeding. That's called hematuria. So blood in the urine, recurrent urinary tract infections. In the late stages, the pressures in the bladder become so high because of the obstruction. These pressures are transported to the kidneys, and they can, in the late stage, can even cause kidney failure. So there can be hydronephrosis. The serum creatinine, which is a test for kidney function, also gets deranged. So these are the late stages. That's the reason we should not allow the condition to go to that stage where it is all, I can say that, irrecoverable stage.
Right. So please don't start living up with these symptoms. Don't, make it a part of your lifestyle. It is treatable. Please go and consult the right person, which is a qualified, a board certified urologist. Another question by Deepak Saxena. The question is, does BPH affect sexual function?
Yeah, definitely. Uh, Enlarged prostate, it is basically it definitely affects the quality of the life. In some patients, I can say not everybody. It definitely the sexual function can be affected. Sexual function is affected not only by the prostate but also by the treatment of the prostate gland. What do we do is when the patient comes to us, initially we start medical treatment. The drugs what we use for the prostate can affect the ejaculation. So, in one way, the gland effect and enlarged gland alone can affect your sexual function, uh, and also the treatment also affects the sexual function. Suppose when the patient goes for an operation called TURP, that is to relieve the symptoms. TURP also affects the ejaculatory function. Patient after the surgery will not be able to ejaculate because we cut the bladder neck, and they will have a retrograde ejaculation. That means the ejaculation, instead of coming out through the penis, the semen, which goes into the bladder. So these are the some of the effects of sexual, but per se directly it will not cause erectile dysfunction.
Okay. Now, doctor, talking about the treatment part, what are the treatment options available for BPH?
Yes. So the treatment depends upon the severity of the symptoms. Patients who have got mild symptoms are usually advised to certain lifestyle changes. Suppose if somebody is drinking a lot of water, and a lot of water will cause more urination, and the person also has got prostate problem, the symptoms gets aggravated. So we tell them to cut down fluid intake, not to take too much of water, and not to indulge in beverages like coffee, too much of taking coffee and tea, and even alcoholic drinks. All this will further aggravate the problem. So after this, if the patient is not responding to these lifestyle advices and he continues to have symptoms, then we prescribe them medicines. Nowadays, we have got very good medicines to treat the prostate. The mainstay of medical treatment is a group of drugs called alpha blockers. We have so many drugs under this category like tamsulosin, silodosin. These are prostate-specific drugs. The drugs we were using earlier, they had a lot of side effects, like they have used to reduce the blood pressure, and also affect by reducing the blood pressure they can cause headache, dizziness. The present drugs like tamsulosin, silodosin are prostate specific. What they do is they relax the bladder neck, so they allow the urine to pass freely through the from the bladder through the prostate outside. So these drugs have to be taken every day, one tablet at bedtime, so they relieve the symptoms. And these have to be taken, as I said, for a long time. There are other group of drugs called bladder relaxants. As I told you, the BPH also causes frequency and urgency and urge incontinence. So patients who have got predominantly storage symptoms like frequency, urgency, We combine alpha blockers like, as I told you, silodosin and tamsulosin with bladder relaxants. There are good drugs for relaxing the bladder, for example, like mirabegron, tolterodine, sulfasalazine. So in some patients, we give alpha blockers and bladder relaxants. And there are other group of drugs called PDE5 inhibitors, like the drugs which we give for erectile dysfunction, like Viagra type of drugs. They also help in relieving the symptoms, in improving the urinary stream. So for some patients who have got erectile dysfunction with BPH symptoms, we prescribe those group of drugs. So basically, that the medication depends upon the symptom severity and what type of symptoms, whether the symptoms are associated with sexual dysfunction. Taking all these conditions criteria into consideration, we prescribe the medicines.
Okay, so these are the symptoms, and a very important thing that you stated initially is that excess of water intake can also lead to such symptoms. But in our society, and I'm sure you will also agree, we get up, we will have 1 liter, 1.5 liter of water. We'll go for bed, we'll have a mug full of milk. Whenever we got up in the night for urination or anything else, we'll have another cup of or glass of water. So, normally we tell everyone have as much of water or liquid intake as possible. But you are saying, doctor, that adequate water is what we need, right?
Yes, yes. So, as patients with this problem, the BPH, like we don't like they should not take water like any other patient. What we tell them is you can take adequate water in the daytime and cut down the fluids from the evening. So, in fact, I tell them to take the dinner at early by 7, 8 o'clock, and not to take any fluids after that, because most of these patients they suffer from nocturia, and nocturia disturb the sleep. So this is how they have to balance their fluid intake.
Okay, right. Now, Doctor, we would also like you to throw some light over prostate cancer. Because the symptoms are also quite similar, and we have heard that doctors say that in all sort of cancers, prostate cancer is a good cancer because its progression is quite slow and it
Correct.
is fully treatable and curable. So, would you like to explain a bit about prostate cancer?
Yeah, correct. What you said is right. It's a very slow growing cancer, but not all prostate cancers are same. Nowadays, you're seeing in the news that the ex-president of USA, Joe Biden, has got prostate cancer, which has spread to the bones. That means a very bad cancer for him, because it is already metastatic. So, prostate cancer in the early stages, it doesn't cause any symptoms.
Okay.
At the most, they may have symptoms like BPH. But when the prostate cancer crosses the boundaries and spreads to the other organs, which we call it as a metastatic prostate cancer, they will have symptoms. The symptoms are because the cancer usually metastasizes to bones, long bones. They will have bony pains, and like any cancer, they will have weakness, loss of weight, loss of appetite. So that is the reason why the PSA screening has come. So because in the early stage, it is difficult to identify the cancer, uh, we tell the patients to go for screening for the prostate cancer by doing a blood test called PSA. Normal cutoff for the PSA is it should be less than 4. If the PSA is elevated, of course, PSA can be can be elevated because of so many reasons. One of the reason is prostate cancer. So whenever the blood test or the PSA test is abnormal, then we have to rule out prostate cancer by thorough evaluation.
Okay. We are getting so many questions. I'll take one more by A. Raju. His question is: can BPH lead to kidney problems?
Yeah, definitely. As I said, if the PPH is neglected, if it is not treated, as earlier I told you, the urine gets stagnant in the bladder, because of the obstruction, urine is not flowing out. There will be a lot of residual urine, and the bladder tries to contract, tries to expel the urine outside, but urine is not going out because of the enlarged prostate, which is obstructing. Increase the residual urine, increase the bladder pressures, all these will be affected or transmitted to the kidneys. So the kidneys they bear the brunt of the disease. The kidneys enlarge. This condition is called hydronephrosis. and they enlarge to such an extent that the nephrons, which is the functional unit of the kidney, they starts getting affected. So this is called renal failure. So the serum creatinine may rise, and all the problems of renal failure can occur. So in such patients, we have to relieve the obstruction as early as possible. Sometimes we see patients coming to our OPD with over distended bladder. The urinary bladder is right up to the umbilicus, and they will have raised creatinine. And if you do an ultrasound, both the kidneys are grossly dilated. So in such patients, we immediately put a Foley catheter. That means we decompress the bladder by putting the catheter. So all the urine will comes out and the bladder decompresses. Even the kidneys also, the pressure decreases. They become to some extent the normal, and the serum creatinine also decreases. These are the patients who need to go for surgery to relieve the obstruction.
Okay. Now, doctor, we have seen in our society, we are so obsessed with home remedies. Nowadays, we have so many influencers on various social media platforms, and even if most of them are not qualified urologists, but they talk about various things and DIYs, etc. Then we have various therapies, and what we, do. I feel as a biggest mistake is that we waste a lot of time on those home remedies, DIYs, other therapies, what he has done, what other friends or relatives have done. We normally land up in front of a doctor a little late. I'm
Correct.
sure you have also seen patients like that. So,
Yes,
what's
yes.
your take on that? Why it's important to consult the doctor as soon as we realize that we are having these symptoms?
Yeah. See, as I told you, the common myth or misconception is, as we majority of the old people think that as we age, they feel that they have to live with these symptoms. They when they meet their friends during the morning walk, so that's how the problem starts. The person who is not knowledge will give advice to other person, wrong advice. So that's how the
Hmm.
circle continues.
Right.
So that's the reason we conduct awareness camps. We do these type of programs to create awareness among the patients that if you have these symptoms, you should not live with these symptoms. You have to get treated. And as I told you, these symptoms are not just because of prostate. There are many other conditions which can cause similar type of symptoms. How do you know that these are caused by different kind of conditions? You have only when you get examined and when you get investigated, then only we know what is the cause of these symptoms. And mild symptoms can be treated. They don't require any medication. Don't get afraid that if you go to a doctor that he'll prescribe you a lot of medicines and they advise you to go for surgery. That's not correct. Most of the BPH symptoms can be managed by change in your lifestyle advice, by change in your drinking patterns, and altering some drugs. Suppose somebody has got taking a medication for hypertension, something like diuretics, and those drugs will aggravate your symptoms. So we modify those drugs, and we even tell them to take those drugs at different times of the day. So I can say 50% of the patients will not require any medication. They can be managed by just lifestyle advice. And only 50% will require some kind of treatment like medication, or only in the late stages, I can say about 5 to 10% of the patients will require some kind of intervention, surgery. That's the reason why you should consult a doctor and properly you have to remove your misconceptions or myths and get evaluated.
Right. So do not suffer in silence. Do not go
Yes.
for other therapies, or don't waste your time, energy, money, everything on home remedies, etc. Because you need to find out what it is. You need to get it diagnosed, and for that you need to go and consult the right person, which is a qualified urologist. So please don't suffer in silence. You can have a good quality of life. For that, please go to the correct person. There are other questions as well coming from our viewers. Tarun Bhargav is here. Does BPH cause pain?
Yeah, definitely. As I told you, the urine has to flow from the bladder through the prostate out. When the urine is not flowing, sometimes there's a condition called acute retention of urine. There's a complete blockage because of the enlarged prostate that causes severe pain. Patient is unable to pass urine. The bladder is distended. That causes excruciating pain. they immediately have to, they land up in emergency in the hospital, and where we put a catheter to relieve the obstruction. That is one extreme condition. But the other condition is BPH can cause recurrent UTI, urinary tract infections, and because of the infection, you can have pain while passing urine, you can have burning sensation while passing urine. Uh, that's how the BPH affects your lifestyle and also causes pain.
Okay, many times patient also ask, can BPH go away on its own?
Yeah, very unlikely. Once the gland is enlarged, it doesn't regress unless you take some kind of treatment. But at the same time, as I told you, the enlarged gland doesn't may not cause any symptoms. So I should tell you how the why there is enlargement. It doesn't occur in everybody. The enlargement only happens in some patients, some group of people. We exactly do not know what is the actual cause of enlargement. I can say what is the etiology of this enlargement of the gland. There are some genetic predisposition, lifestyle changes, and even the hormonal imbalances in the body. The male hormone testosterone is linked to the prostate enlargement. So it doesn't subside by on its own. Enlarged gland doesn't regress on its own.
Right. Rakesh said here, are there natural remedies or supplements for BPH? We have already discussed it. But I would also like to ask you, doctor, is there a way or, things that people can keep in mind to keep their prostate healthy? Because it is a organ which is present in male body. And, many times we have seen many males going for chain smoking, to alcohol consumption, stress is a part of almost all of us now. Sleep patterns, disturbed sleeps, etc. So, how important it is to keep a good, healthy lifestyle, and what are the things that we need to keep in mind to keep the prostate healthy?
Ayurvedic medications, there's some natural remedies, they say. But we are not sure how much they work because there are no properly conducted studies to say that these natural remedies will definitely cause relief of symptoms. There are some medicines like herbal products, like Serenova repens, Pyginia africanum. They have been shown to have some effect, but not 100% effect, and they are prescribed by some practitioners. Uh, these are the only condition, but homemade natural remedies, they're not of any proven benefit.
Okay. Now, doctor, before we sum up the whole session, any take-home message for our viewers? Any message that you would like to convey before we conclude?
Yeah, definitely. Uh, so this is a condition which occurs in majority of the patients as age advances. A majority of the men will have this enlargement of the prostate and thus have symptoms. So my advice for patients who have got this symptom is, do not assume or think that this is age related and you have to live with this. In the present era, there are many wonderful remedies. I forgot to tell you about the surgical treatment.
Yes.
Earlier, maybe 10 or 15 years ago, we were doing some standard procedures like open prostatectomy or transurethral resection of the prostate. These are the surgical remedies. Now, in the last 5, 10 years, there are so many very good, minimally invasive surgical treatments called MIST. For example, Urolift, and for water vapor therapy and implantable devices. They are almost daycare procedures. You can go to the hospital and get the procedure done and go home in the evening. So such kind of therapies are also available if there is an indication. So don't neglect your symptoms. Visit a urologist. Get yourself tested. These are basic tests. The doctor will
Right.
take your history, do a brief examination, or ask for a test like an ultrasound and uroflowmetry, and will guide you properly whether you can change your lifestyle advice or do you need any medication or you need any procedure. What I told you before. So that's the message I would like to tell all the men above 50 years who are living with BPH with these symptoms.
Right. And doctor, because you mentioned these surgeries, as you said, these are very, with minimal intervention, and many few people need these surgeries. But still, because, it is a age-related thing, it occurs only in people, mostly in men who are 50, 60, or 70. So these surgeries are okay, safe, and recovery is easy.
Yes, they're very safe surgeries. In the present era, the most of these procedures are done on the OPD basis, outpatient basis.
Okay.
In a procedure called Urolift, we put clips in the prostate so that the enlarged prostate, they get compressed so that the urinary passage opens up. Then other
Okay.
condition called the water vapor therapy, in that the steam is injected into the prostate gland. So because of the high temperature, there will be necrosis of the gland and the gland becomes shrunken. So that is one therapy. But the gold standard is the TURP. Of course, the laser prostatectomy is also available. We have got very good lasers where we can completely scoop out 200 grams or even 150 grams of prostate. For them, we advise lasers. That's a very good treatment. And we also have got other modalities like bipolar TURP, and other minimally invasive procedures. So a whole gamut of treatments are available,
Yes.
starting from tablets to minimally invasive treatments. And right patient has to choose the right treatment. That's the gist of it.
And for that, viewers, if you have these symptoms or anybody, elderly people in your family who has these symptoms, please don't make them suffer in silence. Go and take them to a nearby qualified good urologist and get them treated. Thank you so very much, Dr. Surya Prakash, for your valuable time. And it has been quite an informative session for all our viewers. Thank you.